Hello there. I'd like to talk to you about how I became involved with chiropractic and then became a chiropractor. When I was a freshman in high school, I was playing football for my football team, and I was a quarterback for the team. And I remember when, as a freshman, our offensive line was pretty bad, and so I got tackled quite a bit. I remember one time in particular, I got hit from the side, and my shoulder was driven into the ground. And I remember at that point having trouble catching my breath, and I had to be helped to the sideline. And I remember developing some neck pain and some upper back pain right away after that. After a couple days, my mother, who was seeing a chiropractor at that time, decided to take me to her chiropractor and have me evaluated. At that time, the chiropractor did an x-ray on me and found that I had a 13 to 14 degree scoliosis that had developed. What a scoliosis is a scoliosis is when your spine, which should be nice and straight when you're looking at somebody from the back, has developed a curvature in it. Now, in my case, my right shoulder was higher than the left, and my head was tilted to the side, and was having neck pain and back pain. Within a matter of a short period of time, my chiropractor was adjusting me and got dramatic reduction in my scoliosis and, of course, my neck and back pain. At that point in time, I got very interested in chiropractic and decided to go on to become a chiropractor in college. I want to let you know about my particular forte, which is working with scoliosis type injuries or scoliosis as it develops in children and young adults. Now here's an example of one of my patients. She's a 12-year-old soccer player. She plays competitive soccer, and she pulled a groin muscle and injured her and developed some lower back pain, and her parents brought her in as a patient. In the course of taking an x-ray, we found that she had a 17-degree curve. And so I explained to the parents, and the parents, of course, were naturally, really, really saddened by this because they were shocked that they hadn't noticed that she has a scoliosis. And what you got to realize is we have two forms of scoliosis. We have a functional versus a structural. Functional scoliosis is quite often like a bow that has been strung with a string. There's a curve to the spine, and the muscles cause that curve to the spine. As soon as we can relax those muscles, or the trauma, the pain goes away, but the bow also straightens. That's a functional scoliosis. That's probably about 95% of the scoliosis that come about. A lot of times they're brought on by trauma or any type of an old injury. Separate from that, we have the structural scoliosis, which are the ones that are less than 5% of the time, and those are the ones that are genetic. Now, quite often, medical doctors don't realize which ones, the difference between genetic versus structural, and they'll assume they're all genetic. And quite often we find that whether they're genetic or structural, brought on by trauma, we can still help them dramatically. In fact, if we look over here, we'll be able to see this little girl's 17-degree scoliosis here. But if you see this, look at this after shot, we can see that it's reduced within a 3-month period of time all the way down to 3 degrees. So it can have a tremendous amount of benefit chiropractically by allowing that structure to straighten out once more by unstringing the bow or relaxing those muscles. We take care of lots of children and as well as young adults and adults for scoliosis. Most often the parents have no idea the child has scoliosis until an x-ray is taken, or in the case of my niece, who is 12 years old, she just happened to be into her doctor for an upset stomach, and they took some x-rays on her back because they were concerned that she may have some abdominal distension, and they found that she had scoliosis at that time. And so it's not uncommon for people to have scoliosis and the parents not aware of it. One of the ways you would check to see if your child has scoliosis is to check to see if they have any one shoulder or the other that's higher than the other, or if you notice that their head seems to tilt one way or the other. And both of those could be an indication that you have scoliosis. But most often, there's no symptoms with it. but it can long-term lead to a tremendous amount of pain in adult life, and especially slow decay of the spine over time. People often ask me, how much improvement can I expect with scoliosis for my child? Well, we find with children anywhere up to about 14 through about age 16, we can get anywhere from 75 to maybe up to 100% improvement in their scoliosis. They're very moldable and very correctable at that age. After age 16, 17, 18, anywhere from up to about 35, we'd expect maybe more like around 50 to 75% improvement would be very reasonable. And in adults, we'll see anywhere from about 25 to 50% would be reasonable. Now, one of the things that we see as children get older, and especially as adults get older, that the scoliosis over time will give rise to an abnormal wear and tear on the bony surfaces of the discs. That abnormal wear and tear on the bony surfaces of the disc causes the spine to slowly decay over time and causes pressure on the nerve roots, which cause back pain, neck pain, headaches, sciatica down the leg, carpal tunnel type of symptoms, or pain down into the arms and hands, insomnia, all sorts of symptoms along there. I had a 4-year-old girl that happened to be going up skiing with her family up to Tahoe, and she came in from the snow, and she was walking up the stairs, and she slipped and fell all the way down the stairs. Most 4-year-olds, you're going to think they're not going to be in pain, but for all the way from January through April, this little girl would complain every night to her parents that her back hurt and her stomach hurt. And after her pediatrician had done extensive amount of testing and was ready to put her on Prilosec and pain medications for her lower back, her friends finally talked her into coming in to see me for their daughter's back pain. And during the course of the x-ray, we found that she had a 14-degree scoliosis, which is quite a bit of curve in the spine. And already with care, this little girl is dramatically improved. She's been in care for approximately about 4 weeks. So we'll do a follow-up x-ray on her after about 2 months and see how she's done. But we would expect, just like that 12-year-old I was referring to, a dramatic improvement. Now, a lot of people wonder, well, what should I do to have my child checked for scoliosis? Don't the nurses do it in middle school? And what a lot of people don't realize is that, unfortunately, unless it's a real severe case, in other words, you look like Quasimodo in The Hunchback of Notre Dame, most school nurses aren't going to catch it. It happened with my niece. They didn't catch the fact that she had scoliosis until she got x-rayed for a completely arbitrary reason. So what I would recommend doing is bringing your child in and having them checked by your chiropractor. Your chiropractor can check her, see if the one shoulder is higher than the other, the ears are off, or the hips are higher than the other, and these would all be indications of a need to get an x-ray to check for scoliosis. The neat thing is when they're children, when they're growing the most rapidly, is when they're the most moldable and correctable for scoliosis. So I hope this gives you some insight on what you can do for scoliosis, and talk to your doctor. Let him check your loved ones and your children and see what he can do for them with scoliosis.